Hello viewers, thank you for spending few minutes on this presentation. I am going to give you a brief information about syphilis, a sexually transmitted infection caused by bacteria. Prior to the COVID-19 pandemic, parts of Saskatchewan, including some communities and the PAGC, were fighting against syphilis outbreak. Unfortunately, the COVID-19 came and swept the syphilis outbreak fight under the carpet. But this presentation is a reminder that syphilis can be treated in all PAGC communities. Like I mentioned, syphilis bacteria spread from the syphilitic source. The bacteria multiplies locally and cause painless sores, spread through the bloodstream or the lymphatic system, and can affect almost any organ or tissue of the body. Some people may have syphilis for years without any symptom. We can say that syphilis goes through 3 stages, and in all these 3 stages, there are symptoms that show to indicate that a person has syphilis. These stages include the primary stage, the secondary stage, the late or the latent stage. In addition, syphilis can be passed on from a mom to an unborn child, and we term this as congenital syphilis. At the primary stage, there's one sign that you're looking for to determine whether you have contracted syphilis or not, and it is a single sore, or what we can also call a chancre. The sore can last for 3 to 6 weeks and heals on its own. The fact that the sore gets healed doesn't mean the disease has been treated. It means the disease is progressing to the next stage. This slide shows how the syphilitic sore look like. It could be on your penis or any area around your genital. In females too, the sore could be anywhere around the genital, and if it is a tiny sore, it will be difficult for the female to identify it by herself. That means if you have sex with a partner and you contract syphilis, please do your maximum best to inform the person so that she could go for a test to know whether she has it or not. Oral sex without barrier, like a dental dime, can lead to oral syphilis. If you are not sure about the status of your partner before practicing oral sex, please use dental dime. If you don't have a dental dime, use condom as a barrier so that you don't get oral syphilis. When syphilis is not treated and cured at the primary level, the syphilitic sore appears to be healed while the infection enters into the secondary level. At the secondary level, there are signs of skin rashes that develop on one or more areas of the body. These skin rashes can appear like any other rashes from other diseases, usually, which does not come with any itching. Other symptoms such as fever, swollen lymph glands, sore throat, patchy hair loss, headaches, weight loss, muscle pain, and fatigue may also be associated with a secondary level. Without treatment, the disease progresses to the late stage. The rashes you see on this slides are a typical example of the secondary stage of syphilis. The rashes could be at any part of your body. being it your back, your palm, or your foot. It could also be on your side. And it's all pointing out that the syphilis has moved from the primary to the secondary stage. At the late stage, the person continues to have syphilis even though there are no symptoms. The disease can damage the eye, the brain, the nervous system, the heart, the blood vessels, liver, bones, and joints. That means the disease at the late stage or the latent stage can cause more harm than any of the first two stages. Signs that might show that you are the late stage would include difficulty in coordinating your muscle movements. Some people might have paralysis, numbness, gradual blindness, dementia, and even death. So the disease is very, very dangerous at the late stage. These are some of the vital organs that can be damaged by syphilis at the late stage. If any of these organs is damaged, that will compromise your health a lot. If you see someone with syphilis at the late stage, these are some of the signs you might find on the skin. A mother with syphilis can pass the disease to an unborn baby. The disease can cause stillbirth, and a baby can become developmentally delayed or may have seizures and even death. Anyone can prevent contracting syphilis by using condoms and dental dams. We provide condoms and dental dams in all our community clinics. If you are in need of condoms, give them a call or walk to the clinic and ask for condoms and dental dams, and you will find someone to help you with that. I would also encourage that any sexually active person get tested for all STIs, and it would be a great deal if you could be tested with your partner, and that will help you know your status and help you avoid contracting syphilis. Anyone can get tested for syphilis and all the STIs. We have a special nurse who can go to any of our communities and help you with the testing and treatment. So, if you get tested positive, that is not the end of your life. You'll be treated and the disease will be cured. If you get negative results, that means be careful with your sexual life. Don't engage in risky sexual behaviors so that you don't contract any STI, including syphilis. Thank you so very much for watching my presentation. Please get tested for STIs in your community. Testing is free, treatment is free, so you don't need to worry about the cost involved. Thank you so much.